Everyone, what is sciatica and exactly what you can do from home to help to decrease some of that pressure and pain?
So today we're going to go through the 4 best exercises that you can do at home to decrease sciatic pain.
So some of our patients are watching this from home. So hi everyone, hope you're doing great. If we haven't met yet, I'm Dr. Dan. This is Dr. Pascal here. We're from Winnipeg Chiropractic. So I guess maybe to start off with, we just want to go over a few things. So today we're going to be talking about sciatica, but again, what is causing your pain or your symptoms? You know, we can't say exactly over a video like this, but we want to give you some simple things that you can do from home to help to decrease some of that pressure or pain.
So if you're watching the video right now, like this video, love it, leave some comments. If you have any questions, please leave them on there. We'll make sure that after we're done this video that we answer any questions and we get back to any comments or questions that anybody leaves.
Yeah. So first of all, so what is sciatica?
Well, just the actual definition of sciatica simply means that someone is having pain in the sciatic nerve. Right. And so it only tells us that there's pain in that nerve. It doesn't tell us what the cause of your problem is, okay? Because oftentimes the sciatic pain is caused by tight muscles, caused by low back problems, disc injuries, degeneration of the spine. And so sciatica simply means that something is causing you to have pain in your sciatic nerve.
Right. So the name sciatica is not a diagnosis for what's going on. It's just simply describing the symptoms that you're coming in with. And after seeing patients with sciatica, you know, there's a wide range of symptoms that you may be coming in with. So sometimes people are talking about a throbbing pain, a shooting pain, a radiating pain down their leg. They could also have numbness, tingling, and also if it's been there for a while, it could also cause weakness into the leg or into the muscle.
Absolutely, and a lot of times people also have back pain with sciatic pain, right? So the sciatic pain can be down the leg, but could even start deep into the low back. It can be only in the low back, it can be the leg and the low back. So again, there's a multitude of presentations of sciatic pain, and the things that we're describing here today, again, are not meant to diagnose your problem, but just to give you some tips and tricks that you can do at home to help alleviate some of that pain, because it can be very severe for people.
Absolutely.
And so these are the exercises that we give our patients as part of their home care to help address and reduce pain while we're doing restructuring work, we're doing adjustments and different things here in the clinic to adjust the cause of the problem in the spine. So once this whole COVID situation is done, you know, we're still recommending that you go out, get your situation checked specifically to find out what's causing your problem so that long term it doesn't get worse and become sort of a chronic reoccurring issue.
Right. And the cause could vary greatly from person to person. So number one, it could be a disc issue, a disc bulge, a disc rupture. It could be damage to the spine from an old injury that's just been progressing over time, causing arthritis, bone spurs that are putting pressure directly onto that nerve that can be causing those symptoms. But it could also be a muscle, a spasm. So whether it's a piriformis muscle, a glute muscle into your lower back or butt, and that affects that nerve going down the leg.
And so, you know, and then oftentimes, again, this is a building thing, like Dr. Dan mentioned, the straw that broke the camel's back. So commonly someone might come in and say, hey, listen, yesterday I bent over to pick up my sock after doing laundry, and then all of a sudden I had this shooting pain down my buttocks, and it's been there since yesterday. Well, likely that problem didn't start when you bent over to pick up the sock. And that's a hard thing for people to realize, is oftentimes the day the pain presents with sciatic pain is not the day the problem started. And so we generally see a buildup over time of damage to the spine and proper positioning of the spine that eventually one day the sciatic pain then appears.
Exactly.
Okay?
So what should we do about it?
4 exercises, we're going to start to show you them right now. So the very first one is called nerve flossing. So Dr. Dan's going to have a seat here at the edge of a bench. Okay, and so what happens is if the muscles are tight, if there's been an injury around the nerve, sometimes the nerve starts to develop adhesions. Adhesions means it's sticky, it's pulling on the nerve, and that can cause some nerve pain. So we want to floss the nerve, meaning it pulls the nerve through its distribution to help alleviate some of the adhesions. Okay, so Dr. Dan's going to take the sciatic affected leg, he's going to straighten it. Okay, if you're having a lot of sciatic pain, it might be hard to straighten your leg. So you're going to get as high as you can without it being too painful. Okay, so if he can get it totally straight, which he is, great. Now he's gonna move his nose and his toes at the same time. So he would go toes and nose up, hold for 3 or 4 seconds, toes and nose down. Okay, so toes and nose move in the same direction. They go up, hold for 3 to 4 seconds, they go down, hold for 3 to 4 seconds. So we'll get you guys to repeat that exercise for 2 sets of 10 repetitions. If this feels good, if it's alleviating some of your pain and symptoms, by all means, go at it and do it as many times as you'd like throughout the day. Okay, so that's exercise number 1. Exercise number 2 is a form of self-myofascial release. So Dr. Dan's got a mobility ball there. A lacrosse ball could work, a tennis ball could work, a baseball could work, right? This here is a specific mobility ball. And the goal with whatever ball you're using is we're going to smash up some scar tissue, some adhesions, and we're going to put some pressure on those glutes and piriformis muscles to get them to relax, release, and ideally take some pressure off of that sciatic nerve. So you can see Dr. Dan is making faces, and he's not doing that intentionally. This can be quite uncomfortable because those muscles can be tender. And so he's creating circles with his leg, right? You can also perform a clamshell movement where you kind of bring your knee in and out to the side like he's doing now, right? The goal there is to create motion in the hip and get as much mobility as possible, covering the whole glute muscle. So this you can do for about 3 minutes total. That's a sufficient amount of time to get throughout the muscle belly and get some work done in there. The next 2 exercises are going to focus on stretching, because oftentimes sciatica can be the result of tight muscles progressing over time, or the sciatic pain can be so intense that it then triggers tight hamstrings and tight muscles from there. So you're going to get a strap. You're going to wrap a strap around the ball of your foot. That strap could be a belt if you're stuck at home. It could be your dad's necktie that he doesn't wear anymore. It could be a towel. It can be a sheet. Anything that you need to wrap around your foot, okay? Again, you notice that Dr. Dan is starting with his leg bent. So the sciatic affected leg is bent. And the reason he's doing that is because people with severe sciatic pain, it's hard to straighten that leg. So you start with your leg bent, and then you gently straighten it until the point where you start to feel some tension or some discomfort, and you hold it with gentle discomfort. This should not be screaming, should not be very painful. In a perfect world, if you can get that leg straight, great. And then if you want to progress it further from there, you can wrap the band around the toes or actively point the toes towards the head, and that is going to stretch or create as much strain as possible throughout the muscles of the hamstrings and the sciatic nerve, okay? You could hold this for 30 seconds, repeat it 3 times. So that is the hamstring stretch. The next muscles we need or want to address are, again, anything on the glute, so the posterior hip. So that would be glute and piriformis. To do this, we're going to do thread the needle. So again, you take the sciatic affected leg, you bring that leg up, and you notice that Dr. Dan took his left leg and he put his left foot on top of his right knee. So we're targeting right now the left glute or the left sciatic nerve. He reaches through, he grabs the hamstring, and he squeezes those legs towards his chest. And by doing that, he's increasing the stretch here throughout the glutes on that left side, getting a good stretch in those muscles. If that's limiting, you can't reach in there, if you're having some back pain, maybe that's too much, you can just grab the affected knee, squeeze it to your chest, and more importantly, try and bring it across to your opposite shoulder. So left leg or left hip to the right shoulder, and then vice versa, depending on what side is being affected for you. Okay, so just a quick recap of those 4 exercises. We showed you guys how to perform the sciatic nerve floss. We talked about the mobility ball to do some self-myofascial release. We did a hamstring stretch banded, and then we showed you guys how to address the glutes and piriformis doing thread the needle.
So key thing, especially when someone's going through pain as well, is try to create a routine around this as well. So meaning that, let's say it's every hour on the hour, go through these exercises, which will take probably about 5 or 10 minutes. Then go for a little walk, go up and down the hallway, go outside on the sidewalk for a few minutes. It doesn't have to be a lot, but it needs to have a continuous motion to help to decrease that pressure or pain.
And also, we mentioned earlier, a lot of people with sciatic pain, because it's back, spine related, have a lot of back pain. So if you're dealing with some significant amounts of back pain, look in the comments after this video is done here. We're going to post a YouTube link for an exercise video for 2 of the best exercises that you can do at home to decrease low back pain and take pressure off those discs.
Exactly right. So what we're going to do now is also next week we're going to post other videos in terms of some stress breathing, some neck issues, headaches, sleeping positions. We'll go through different videos as well. But also we did a few Facebook Lives. We did one last Monday, or this past Monday, and last Thursday. So just go back and look at those videos. We did one on posture in terms of how to reverse fix your bad posture, and also the 4 best exercises to bulletproof your lower back.
Okay. If you have any questions, comments, please leave them. We'll make sure we address them after the video. And if you want to reach out to us for any reason now or down in the future, info@lindenwoodschiropractic.com.
And don't forget, just like my kids say, like us here, check the subscribe button down below. Have a great day.